very famous Phil Tozer. No, it's an honor and pleasure to have Phil here.
Thank you.
Because he's one of the most experienced proctologists I've ever seen.
Thanks, man. It's very kind of you to invite me. No, thanks for having me. It's been great. Well, it's always very exciting coming to St. Gallen. It's a great conference, very well organised, really interesting content, good speakers. There's always lots of time for discussion, particularly in the pre-conference courses, and it's a beautiful place. So I'm excited about having a good time with good colleagues and learning lots of really interesting coloproctology. You know, there's all of the kind of big names, you know, people like my colleague and friend Danilo Miskovich is here, and there's all of the people who have organised the conference, and you know, there's always lots of great people to meet and that I see at conferences. But what I really like is meeting people that I've never met before, and we just saw a session that was all about the aftermath of rectal cancer surgery, and in particular we were talking about the impact on sex for patients, which is not very often discussed. And one of the delegates came up to me afterwards. I'd never met her before. We had a lovely conversation. You know, that kind of expansive discussion doesn't happen except in conferences, and well-organised conferences that are thought-provoking and discussion-provoking. So that's what I find most exciting. Yeah, so we had a really interesting session about perianal Crohn's disease, and it was Oliver Schwanner and me, and we both talked about different components, but I think it's really important to carefully classify patients with perianal Crohn's disease. Make sure you tailor your treatment to the individual in front of you. At what stage are they in their life, and so on. Klaus Matzel asked a brilliant question at the end of the session. You know, how do you really carefully tailor treatment? And it's all about speaking to and listening to the patient to work out what their goals are, where they are in their life, what's important to them right then, and try and navigate through the options with them to choose the right next steps for them. That's the really key component, I think, key message to take out of my talk. So what are the important early features of perianal Crohn's disease? Well, I guess the most important thing is to be able to pick up those patients who have got Crohn's disease, but we don't yet know it. So a lot of patients will present with an abscess or a fistula, and we don't necessarily know that they've got Crohn's disease, but this is an ideal opportunity to make an early diagnosis in that group of patients. So everyone needs to have their own version of how you're going to pick out those patients that it's worth following, but there's a piece of work about to be published called the Prefab Index, and that's a scoring system produced by the team from the AUMC as well as the Top Class Consortium that will help you to pick out which of the patients you should be investigating to wonder if they've got Crohn's disease when all they've done is present with a perianal abscess. And it's things like the presence of a family history, younger patients, more complex or recurrent tracts. These kinds of things should prompt us to think, well, I'm going to ask about their bowel habit. Is it possible that they've got an underlying inflammatory bowel disease? So that early diagnosis piece is probably the key in terms of initial symptoms.